Welcome everyone to this edition of Office Hours. The title of today's session is The Realities of Re-Verification and the Future of Intelligent Automation. And that title sounds like a mouthful, but promise you it's going to be a lot of clarity when we get through with this. I'm actually joined today by two terrific guests, Laura Pata, who's our AVP of Customer Success, and then Jonathan Aguiar, who's our Senior Solutions Engineer. So I couldn't have two more intelligent as well as dedicated as well as capable people to explain this topic to get today. We were talking off camera a little bit today about how these two are the OG of office hours. So they know exactly what they're talking about when we're in this particular subject as well when it comes to PT, OT, re-verification processes. So how the two of you doing today?
Doing well. Happy Thursday.
No
Happy
complaints
Thursday.
at all.
Awesome.
If I were to complain, no one would listen. That's what they say, right?
Right, so don't.
Might as well not complain.
Oh, well, I would listen. I would
Oh, I
definitely
appreciate that, Stuart.
Yeah,
Appreciate that.
Stuart's a good listener.
Yeah, I like listening. So, well, that's excellent. Again, just glad to have you with us. Today I just want to give a kind of a preview of what we're going to talk about. And that is the re-verification season that occurs every first of the year. It's best described as perhaps a surge, or I like to call it a tsunami. But we're going to actually dive into why it creates such challenges for practices, maybe even some anxiety, how organizations typically get through it, and what automation looks like today, and finally, where AI and intelligent automation can take us in the future. So before we dive into the questions and before we dive into the subject matter, I just always want to remind everyone that we're going to leave time at the end for audience questions. So be sure to drop those in the chat as we go along. You can put them in Q&A, you can put them in chat. We know where to find them. But I also encourage comments. Anyone's got any suggestions, anybody's got any insights as you hear us speaking, you can feel free to be part of the conversation through the chat as well. So with that said, Laura, Jonathan, y'all ready?
Ready.
Awesome, awesome. So Laura, I just want to start with you because you deal a lot with our clients, particularly in this arena. So just want to go, let's start with the problem itself. What do practices experience when January rolls around and hits and the re-verification wave begins, as I called it before, the tsunami?
Yes, that's a great way to describe it. It's definitely pure chaos, a tsunami. It's a surge that happens. It doesn't affect just PT/OT groups. It affects our orthopedic groups. It's multi-specialty. Basically, at the beginning of the year, we're facing insurance plan and coverage changes, right? Many patients change insurances at the start of a new calendar year. It's often tied to those employer benefit renewals. Policies are terminated, benefits are reset, including deductibles. So, the out-of-pocket maximums, which affects, patient pay responsibilities. So between all the coverage changes that has happened, making sure that you guys are up to date, the practices are up to date, knowing that, it's not going to end up in a denial. That's part of it, the financial burdens, but then also the administrative bottleneck, because it's like you need additional staff for a temporary amount of time, right, to get through these re-verification season, which usually lasts. Some of our customers, just do it for the month of January. Some of it goes to mid-February. But it's a strain, that's happening during the holiday seasons. You have to prepare during the holiday seasons. No one wants to work. They want to spend time with their families, go on vacations. You're also dealing with the web pair portals and clearinghouses. They're expecting, their system shut down too, just because there's such a high volume of these rechecks at the beginning of the year. Sometimes their data isn't up to date. Sometimes it takes weeks for them to update. So it's like a constant follow-up. Obviously, besides the financial side of it, not verifying the eligibility and benefits, but if by chance you get a denial on the back end for inactive or incorrect coverage, there's cash flow delays because of the fact that patients don't want to come in, because of their resets. The patient collections don't happen because of the dollar amounts. So between financial impacts and the administrative bottlenecks, all the insurance changes, it's a heavy weight that all of our clients face, during the beginning of the year. And like you said, it's an absolute tsunami.
Yeah, and I'm also amazed when people are surprised when the holidays come. You can do the same analogy here. It's almost like the holidays, they come the same time of year every
Yep.
year.
Every year, just like
This is
verification.
this is no different. This is going to come every year. Yet
It's
people are like,
the
"Whoa!"
Yeah, it's like your Christmas present after the fact. Yeah.
Right, right, exactly, exactly. So with that in mind, practices have to get through it somehow. So how can practices be more prepared other than, hey, mark it on your calendar,
Yeah,
maybe
mark it on your
around.
calendar. You could hire temporary, you can outsource. That's the great thing about our customers that they use us to do a lot of the verification work, getting those new authorizations. But in order for any practice to be prepared, proactive, it's like you got to think about how you're going to communicate to those patients, right? Making sure that those January appointments, you're reaching out in December saying, hey, if you know of an insurance change or if there's any resets, ask them for their new insurance card as soon as they get it. Flag those patients that you already have in your system with an expiring coverage, right? Like, so if their coverage ends December 31st, then most likely that's going to be re-verification and flagged and, put at the top of your work queue.
Mhm.
The process basically starts, it can start at the end of December. We know that there are several portals that will go live usually the last week of December. We also know which ones lag. And so we kind of have to prioritize which ones that you think you can put more hands on deck initially to get those done first for the first couple weeks of the month. Deciding on, how are you going to do majority of them drop to a phone call too. So it's about your workflow optimizations. And then it's, when you're not only re-verifying the data, but you also got to see if there's an authorization already on file. Because if by chance, it's for an MRI, January 2nd, January 5th, and there's already an auth on file, well, that coverage change, you have to go get a new auth. So most likely you're going to have to reschedule. We do have some customers who will only see Medicare patients the first couple of weeks of January. They won't even deal with commercial payers just because they've had so many denials and write-offs because of this whole re-verification process.
Mhm. That makes sense.
Yeah, optimizing, automating as much as possible is going to help. Training up your staff, getting prepared. Like I said, it's a small surge, a smaller time window, but being prepared is most critical.
Right, right. And it also, I know that it's really at the mercy of employers as they change insurance. They're
Yeah.
changing, and that happens in October. Everyone who's obviously experienced, who's employed and has some insurance provided by their employer, that open enrollment happens in October, pretty much the 1st of November. Then there's that time lag there. But again, it kind of goes back to we know what's coming, we know what's happening. So, your message is clear, start early on these
Hmm.
preparations,
Yeah.
what needs to be done.
Don't wait till the last minute. It never works.
It never
Yeah,
works,
it never
ever.
works.
Well, that's awesome. I think that switching to Jonathan now, I want to ask you kind of some from a technical angle. What makes re-verification and specifically more complex than just your day-to-day eligibility and benefits checks? Because practices are doing this all day long. EVBs, they're getting new patients, they're having to get prior authorizations, they go through that process. But re-verification brings its own challenges. So, we at Infinix, and I'm sure, with others, are leveraging automation now. AI is everywhere, but just
Hmm.
because it's called AI doesn't necessarily means it's AI. So, but we do have intelligent automation. We have automation agents as well that are deployed through that system. Can you kind of describe that, that the complexity of the day-to-day versus the complexity of the re-verification process?
Yeah, that's a great question. Well, it was already mentioned the tsunami metaphor is actually a really good metaphor. The word surge is a great description. So the process itself isn't what makes re-verification more complex. Actually, both re-verification and standard verification of benefits follow a very similar workflow. The hurdles are completely around the sheer volume, the timing, and the variety of payers involved. There's just too many variables to consider. So yeah, on the automation front, you're able to isolate those variables and really focus your attention on those manual intervention requirements. But ultimately, verification is a surge challenge when a large number of verifications need to happen in a very short window of time. So like Laura mentioned, like having the tech and the automation is great, but at the end of the day, the operations and workflow management is key because it comes
It's
same
key.
time every year. So you gotta get ahead of it.
Right. Exactly. And it's and relying on those, it's like the process doesn't necessarily change. It's just that now they're more frequent and they're coming with reckless abandon, so to speak, one after another. And you just have to be sure that you're coordinating all that and the ability to do that. So
Well, and the automations, it's limited too, if you think about it, because if the web portals aren't updated or they go down, your clearinghouses aren't updated or it goes down, there's slowness, it's always going to drop to a manual function. So the tech-enabled service approach is great because sometimes you can get some of that partial automation through the connectivities, but partial isn't everything. So you need the staff to help,
Mhm.
obtain the rest of the information as well, or read
Right, right.
those authorizations.
And I'm glad you brought that up. It's tech enabled,
Yes.
so to speak. So it's not just automation alone.
Mm-hmm.
It's actually automation plus staff in many instances, because at this time of year, to your point, you know, the portal may not be up.
Yeah,
The
you
insurance
can't
company
rely on
may have,
automation then. You can't,
yeah, they may not
what
have
do you
their
do?
act together,
Yeah, very
and as
dependent.
yeah, and as you said in the beginning, we know who those bad actors are. I
Yeah,
call them bad actors, but they just, for whatever reason, their workflow is not caught up. So the automation itself is not necessarily limited. It's just that we're at the mercy of the portal. We're at the mercy of the insurance, having everything up. So it's really where, yes, you have to have that staff, whether it's Infinix staff, whether it's the staff, the clients, leveraging that to make sure that it's staff augmentation, I
yeah,
think is the key word there. So it's knowing that they're not alone, that you use automation as far as you can take it. But then with those exceptions, you will have to deal with staff. So it can alleviate in some ways the pressure that staff has, but the staff's still going to have to roll up their sleeves and get ready. Put on your life preserver, I guess.
lots of phone calls. Yes,
Yes, yes,
lots of wait time, hold times. Yes.
sure,
Well,
sure.
and from a technical perspective, like no matter how advanced technology gets, at the end of the day, it's built and maintained by human intelligence. So,
Mhm.
technology is only as good as what supports that technology. So,
Mhm.
eh, healthcare or not, like you have to audit and maintain that technology in order to improve it. You can't rely on it as a end all um, for all. So.
Right, right, exactly, exactly. So as a follow-up question, Jonathan, automation plays a big role in re-verification today, as we've discussed here, as well as, augmenting staff. Can you walk us through what's being automated now, and specifically things like payer mapping, insurance discovery, eligibility and benefits, and prior authorization? I want to pause there. I have a second part of this question, but can you just kind of talk to how that's done in the day-to-day in our normal EVB and prior authorization processes? And that definitely contributes to the re-verification process as well.
Yeah, happy to. I'll dive right in here. So, firstly, what I'll say even before going into the weeds there is our system is very customizable, both architecturally and operationally. We don't provide an out of the box solution and tell clients, I hope it fits your needs and good luck. We're very we like to call even our customer relationships partnerships because in reality, during onboarding, we establish a standard operating procedure and decide on the best course of action to push the data into Patient Access Plus, focusing on filling in the gaps of their current workflow, but also enhancing what they're already doing. Because at the end of the day, the customer knows best because each customer is going to have particular nuances, even if they're similar to the next guy. There's going to be unique circumstances that
Very
we have
customized.
to consider. Yeah,
Yeah, so not
absolutely.
every customer is different. Everyone has different ways that they manage the verifications, even prior authorizations. It's completely customizable. It's not just straight out of the box. This is what you get. Like, no, we try to
Mhm.
make, the onboarding, the experience very much personalized to each customer.
Mhm.
So that's spot on.
Right, right.
Thank you. And that's coming from Laura, who's the head of customer success. So I said something right.
Yeah, you said it right. High
Yeah.
five.
Let's go intelligent payer mapping first. So we have an extensive database of payers that already exist in our system. So whenever a customer is onboarded, we add those additional payers. Usually it's like the localized payers that have to be added. A lot of those major players are already in the database. With that being said, it's common that payers have the same payer may have two different names on our database versus a customer's database. So, for example, BCBS versus Blue Cross Blue Shield, same payer, but different vernacular. So our intelligent payer mapping will match the values to the customers to ensure a smooth handoff, and it reduces the need for them to have to constantly double check, and also for us to double check. So it's smart enough to match those same payer names. So it not only allows you to verify insurance and benefits in real time, it is also able to discover coverage that the patient may or may not even know existed, or maybe there's a new insurance and the old insurance. So it's able to discover all those nuances. It does so by, if you want to nerd out with me for a second, so it does so by using a combination of robotic process automation, artificial intelligence, and analytics. And what it does is it predicts, identifies, and then verifies that insurance. So those RPA bots mine for data using expansive network of clearinghouses, direct payer connections, and it's all supplemented through a network of both public and private databases. So very large data set. So using all of that, the analytics, the machine learning, the patient demographic information, insurance profiles, that's how we identify and verify. And then the final step of that, once we gather all that information, is to push that back into Patient Access Plus, which will then push it back into the source clinical information system, EMR, RIS systems, list systems. And that can be over API, HL7, or RPAs, again, speaking to our customization. On the eligibility front, I like to say EVB for short, eligibility verification of benefits, because that's a mouthful. So we have queues that will orchestrate the work being performed. So once the transaction is received, the case is then validated, verifying that all the required fields are met before we submit to payer or clearinghouse to ensure there's no bounce back, though bounce backs still happen. We leverage 270, 271 EDI transactions, and again, robotic process automation to fall back on. We have multiple clearinghouse integrations, real-time, multimodal. I always like to harp on the multimodal thing, because if one clearinghouse goes down, we have other clearinghouses that we can pick up where that one dropped off. And I won't throw anyone under the bus, but this past year we had quite a snafu go on. So during that snafu, we were able to activate another clearinghouse.
Are you talking about Change Healthcare?
Yep, you said it. Change Healthcare. Yeah, everyone knows.
It's not a secret.
And obviously, it's easy to say, we just picked up where it dropped off. There's still transition that needs to happen, and it's not an easy situation, but having high availability backup protocol is key in the industry.
Yep.
Yeah.
Right.
I have a friend that works in collections for healthcare, and he had to actually start sending snail mail because the portal was down. He couldn't do his job.
Yeah.
I was like, wow, I didn't know that was a possibility. So once all that happens, the final eligibility determinations are stored and automatically communicated back to the clinical information system. And then on that vein, because it is relevant, we can automate up to 90% Medicare verifications for PTOT using our direct payer connections and automation agents. We identify the auth and referral requirements, network status, plan types, etc. On the prior auth front, and I'm trying to break this down in a way that's understandable. So it's similar to eligibility with some additional steps, obviously, because prior auth is a little bit more complicated. So after verification, the case will go through 4 phases. So it's determination, initiation, follow-up, and then the final status update. So the determination engine is where our machine learning and artificial intelligence lives, again, using a large data set. And it's our data, it's all of the various databases, both public and private, that we can pull from. And it will compare all the pairs, procedures, the specialties, and then determine whether or not auth is required. And if auth is required, that case will then be passed to our initiation engine. During initiation, Patient Access Plus will try a direct API connection first, RPAs next, and then manual assignment as a fallback. I like to say all bases are covered, and then the end result happens automatically, because most clients, if they're using us for our Tech Plus services, don't really care necessarily what's happening, in the factory, so long as the end result is correct and it's as quick as possible. So our system's always looking for that path of least resistance. So we can customize the cadence once we do initiate for follow-up. So for example, a customer may say, hey, go ahead and hit the pair portals every 2 hours, but if it falls within 48 hours of data service, let's assign that to a human agent to get on the phone and expedite that case. So we're, again, very customizable, both technically and operationally.
Yep.
And the last thing I'll say to summarize all of those points, irregardless of our product type, the add-ons, the features, our system is always looking for, again, the path of least resistance with a combination of digital and human agents. Where automation is possible, it'll default to that. Where manual intervention is required, it will automatically assign the work to a human specialist. It constantly picks up and drops off human and digital agents. It doesn't really care who's doing the work as long as the work's being done completely and efficiently. So we like to use the term our system is agnostic. So digital or human agent doesn't care, automation or manual process doesn't care, so long as the end result is exactly as expected.
Right. That just what you described is this complete orchestration, so to speak, of
Well said.
everything. You kind of have, sitting in the background, it's just making sure the work's getting done in an efficient way. Again, to your point, whether it's automated, whether it's augmented by, the staff is working on it as well. It's handing it off to make sure the ball's not dropped, with the cliche there that we all know. But it's, to me, yeah, it's that orchestration. It's just making sure it's not just static. Did my job here, now whatever, someone's got to take over from here. It actually orchestrates and makes sure the work is getting done, especially during this time, because as Laura said earlier, this is a hectic time, and you stated that as well, Jonathan. But and you did the second part of my question, you covered that, because I was going to ask you, how does this affect specifically the PTOT and those automation agents? But you laced that in really well, and everything that you had there, especially in my opinion, one of the biggest bottlenecks I think that would happen. There are many, but I think it's that with the patient changes insurance and they don't even let you know,
Yeah.
or they don't even
They don't even
remember.
know sometimes.
Right?
Yeah,
Yeah,
exactly.
they don't
It's
even
like,
know.
I realized I went from Cigna to Blue Cross Blue Shield because it's a new plan back in October. Well,
Right,
January
right,
1st comes rolls around. They're like, wait, what? I forgot I did this, or I had no idea.
right, right. Or the plan changes,
Yeah, or
or
the plan changed and they don't know what that means.
maybe you're a dependent,
Yep.
maybe on your, like, you know,
Parents.
my
Clearly.
children are, they
Yep.
don't know that the plans change. They just know, here's your card, and they have no idea. Now they're all across the country in different cities, and they're going to see their, for various needs, and they're like, oh, wait a minute, our insurance changed, and they don't know till they get
Yeah.
there.
Oh, they're out of network now. My doctor's out
Right,
of
they're out of
what
network
do I
now.
do? Yeah.
Yeah, yeah. So what amazes me is how we leverage that insurance discovery as well, and that is just gives all of our clients peace of mind.
Yeah.
That part of that layer of automation is that insurance discovery. And I
Right.
think you did touch on that a little bit, Jonathan, but I just don't know if you wanted to.
Well, the insurance discovery is also great for a lot of our customers because it's able to identify primary versus secondary. Sometimes
Yes.
a child could have their mom and their dad covering them, but they don't know which one's primary, secondary. Or you
Mhm.
have some of these, older folks where maybe they have, they say they're self-pay, but maybe they have some supplemental insurance that they don't even know about. There's so many caveats in terms of all these possibilities where insurance discovery comes into play and is super critical for a lot of our customers.
Yeah,
Now,
yeah. I think without it, especially during this barrage of re-verifications that everyone gets at the beginning of the year, that's just so critical because you need that information instantly. You need that
yeah,
information quickly. You don't have time to wait for a patient to fumble through, call their parents, whatever the case may be, to find out what the new insurance is. So yeah, that's just another way that's very seamless. So that's great descriptions of what we're doing today. I also ask everyone, all the guests, I don't ask all guests this type of question, but the type of question is like your wish question, or basically, what would you do if you were in charge type of question, right? Which I know is a dangerous question. But I just want to say, today, we've got a blend of that automation and staff expertise, but what about tomorrow? Looking forward, I just want to hear from either of you or both of you, where do you see automation and AI making the biggest impact in the future?
want to go first, Jonathan?
Sure, sure. Um, Well, the something we were discussing even before office hours is predictive modeling, and I think that's really the future state, especially even short term future state of artificial intelligence, where because it's looking at such a large data set, it's able to anticipate, what things that human intelligence simply couldn't, based on all of these various metrics. And as everyone knows on this call, like healthcare as a whole is so complex. Like there's way too many variables to consider, way too many pairs, way too many specialties, way too many procedures. J codes and CPT codes. It's hard to keep up with all of it. So all of that data set is ingested through artificial intelligence. And based on that, it can then say, okay, based on all this historical data at this specialty type, at this particular procedural level, this is what we can anticipate in the future. Like we're not there yet as a whole, but I see that as being a good future state wish item.
Right. Yeah, Laura.
Yeah, I agree with Jonathan. I mean, it's just, the predictive modeling, being able to have, the AI reading. It's all data. There's so much data out there. Being able to help prioritize operations, your inside your in-house staff, like what can we do, based on previous trends, previous years that we've done this, like what's going to help me identify and flag these cases sooner rather than later, whether that's figuring out when that coverage expires, running through all the data. Okay, these are the ones where most likely there's going to be a change or we need to re-verify, put that at the top of the queue. Who knows? Maybe the same patients come over with the same patient for the last 5 years. Most likely they might not change, and they're retired, older. You get to think about the demographics of the patients. But there's so much ML AI that can be created to help with this process in the long term. I mean, it's all data, right? And there's tons of
Mhm.
data.
Right, exactly. So you can see all that information to where you can kind of say, okay, who do I need to rise to the top? Who do
Right.
I need to prioritize? Which patients do I need to contact?
Yeah. Or which ones do
Yeah,
we have to reschedule now just to give us
mhm,
by some more time to get this done so we don't end up in a write-off or a denial or
right,
anything like that. It's just, what can we do to help prevent that?
right. It's just better organizing. We call it workforce management in some ways,
Yep.
with some of our other solutions. And it's just managing, just making some sense of where to start, where to begin, and what's that flow look like in that prioritization process. It can help tremendously. Some are just taking one at a time. They're just and making those phone calls, as you said earlier.
Mhm.
I think for me, it's one area I think automation and AI could have a big impact is um, is the future of patient communication around reverification. We talked
Yes.
about it earlier, but I think right now so much of the burden falls on staff to track down new insurance cards, confirm benefit changes, reschedule when coverage lapse. But just imagine if AI could proactively monitor when a patient's coverage is about to reset, and then
Mhm.
automatically reach out to them, whether it be text. I find most people it's text, email, or even through the portal just to request updated insurance information. I know we talked about insurance discovery earlier, but that's just one tool. It would be very helpful if you just have that communicate, be proactive in communicating. Say, hey, I noticed your insurance coverage is about to change.
Yeah,
Um,
exactly.
and how can we get ahead of this? And it helps the patient too. You spin it where they realize, hey, I'm not going to get in 1st of January if I don't get this done.
Hmm.
So it really puts a sense of urgency in there. So the benefit is really that staff doesn't have to spend hours chasing that paperwork, but also the client gets taken care of with a smoother transition into the next year. So, yep, awesome.
And
So
on
we
that
are,
vein,
go
I
ahead.
think a lot of the handoff, like the idea of having a suite of products too, like the more and more we're able to combine those workflows and reduce the need for both clinical staff and patients to hop onto various portals, to hop onto various links. You got a text message here, an email there, a portal there. If you want your verification benefits, you go here. You want your prior auth. I think the more we can centralize that front and back office, like a full suite of products, the easier, the less friction there will be, and the easier it will be to ultimately get those results you're looking for. And that'll only be a win-win for both patients and the staff supporting.
Absolutely. It's all about being proactive. Absolutely. So for now, we're really approaching, our time, but I want to check and make sure there's any Q&A. So I want to encourage everyone, now's the time to please put in a question. Also encourage comments, like I said earlier. I'm going to look here and see if we have, do have one. Yeah, I do have one now. So how do integrations, it's a good question about integrations. How do integrations with common PT platforms help streamline re-verification and prior authorization workflows?
Ooh, it's real time. So with the integrations that we have with our PTOT groups, we get that real time. So there's no data entry, there's no bulk uploads. It's basically they just send over the patients that need to get re-verified. We get it instantly. We work it, whether depending on, the turnaround times will vary if it drops to a phone call and, we have to wait on a 3-hour hold with Blue Cross Blue Shield.
Mhm.
That'll vary in terms of when it's completed, but once it's done, it goes right back into to the EMR. So as soon as it's completed, we finish it and it's right back in there. So you can either see the patient, you'll see the details before the patient's seen, or if you notice that, they actually need a new prior authorization, the benefits did change. Let's go ahead and reschedule because last thing they want to do is getting, not being paid for some visits or the patient has to take on that responsibility.
Mhm.
So the direct integrations are key. It's probably the most beneficial way to send us a large bulk of volume.
Right, exactly. And particularly, I know one of the most common for PTOT is Raintree. And,
Yeah.
to me, it's all about that, as you said, that smooth transition, but they don't have to go to another platform to do the
Right.
work. They do
Nope.
all the work in Raintree
Mm-hmm.
instead and
They don't even use them.
leveraging our automations,
Mhm.
leveraging, the communications to where the exceptions happen to our staff, and then there's that back and forth and everything comes back to Raintree. So that's the luxury. Because
Yep.
people don't want to log into yet another software. They don't need one more password to remember,
Right.
right?
And they don't want to copy
So,
paste. They don't
right.
want to they just want to work out of their main system.
Mhm.
And
Right.
ours will always exist. All the data is there in case the APIs go down, whatever, you can always go back to our system. However, just for, the workflows and keeping that efficient and not having, people going to different portals, copying, pasting, just work out of one system.
Right, right, right. So we do have one more question. As I say that, I should probably read questions before I say that. We have one more question. But in some of your case studies, you've mentioned near real-time push and pull of eligibility. Yes, someone's been to our website. Um, Push and pull of eligibility benefits and authorization details into EHRs or platforms.
Yeah,
How realistic is that today? And where do you see it going?
it's very realistic. It is
Mhm.
realistic.
Yeah, yeah, you just
It's
described
happening
it.
now. It's real.
Yeah, yeah, yeah. It's happening. We're doing it. And it's not just today, but we've been doing it for a very long time.
Very long time.
Um,
Yeah, I'd be happy to add some items to that. So my primary job at Infinix is just to do demos of our Patient Access Plus platform, and I'm always careful because it's easy from a sales perspective to keep in the back of your mind future state of product enhancements and kind of give a teaser of what's coming down the road. But ultimately, yeah, we do have those connections, out of the box, PTOT labs, radiology, so much automation involved in all of those specialties. But at the end of the day, your system's only as good as the staff that support it, like I said earlier. So having a system that's learning from all of those hops and variables
mhm.
through the workflow and can get better over time where this particular pair opens up an API connection. Okay, now we can automate that. Or this TPA opens up a connection. Okay, now we can automate that. So as the staff are doing the work, as the automation is doing the work, we're learning from all that and we're looking for that path of least resistance. So yeah, yeah. To put it simply, yeah, we're already doing it and we're getting better each day, each week, each quarter.
Yeah, I've been in this industry for a long time, and I've seen a lot of changes in technology through the years, and I've never seen the acceleration that the technology has been making just in the last 6 months
Agreed.
compared to the first decade or the last decade or even the last couple of decades. It's it's astonishing at the rate that it's accelerating and what the capabilities are. Just been on a couple of calls recently where, yeah, we may have talked to someone a couple of years ago for whatever reason. Now we're talking to them again. They're like, oh, wow,
Yeah,
there's
things
some
have
amazing things
changed
y'all are doing
drastically.
now.
Yeah.
Right,
I've been on
right.
a couple of those calls too.
Yeah, yeah, it's
Here's
interesting.
12 new things. Which one do you
Yeah.
want?
Yes.
We're like, wow, I didn't even know. Oh my God.
Yeah, this is stuff we can do. This is stuff we
Yeah.
can do. Wow. Well, I want to thank both you, Laura, and Jonathan for being on today. We'll probably have you on again in the future. So
Oh,
you
no.
never know.
Please, here you
That's
are.
right. That's right.
I
And so,
appreciate
and
you too, Stuart.
if anyone who's listening, just be sure that you go to our website, infinix.com. We have some more material, more information out there that you can leverage, particularly PTOT, but also any specialty as well on this subject. Be happy to answer any questions. If there was none you could think of here, it's always the case. You know, when you hang up the phone, you're like, oh, I had this question. You can always reach out to us. We'll answer your questions specifically. Better yet, you can schedule a demo with us. We'd be happy to. I love asking clients how they do this today. I want to know how you're working today, and that's one of my favorite things is to speak to prospects and clients about what they're looking for, and then we cater that solution to you appropriately. So until next time, I hope everyone has a safe weekend, and we'll see you next week on the next episode of Office Hours.
Thanks,
Take
Stuart.
care. Thank you, Stuart.
Yeah, you're welcome. Thank you all.